Check 1, 2, 3. Mic check 1, 2, 3. 1, 2, 3. Oh yeah, there's a.
Hello, and thanks so much for joining today. It's nice to see all of you again. With a relatively calm summer, we haven't had a briefing in a while. But with this recent uptick in COVID-19 transmission and hospitalizations, we have received a lot of questions from both the media and residents about the implications of this increase. So today I'm just going to quickly go through some of the most recent data and some recommendations we have for reducing risk. I want to note there's nothing that's changed. So we're not announcing new safety measures today or new opportunities for people to take certain actions. We're just going to sort of run through where we are with the data and again, highlight some of the recommendations that we can all take, sensible recommendations to reduce our risk and the risk of people around us. Dr. Gemma Morales-Meyer, who's our Director of Clinical Services, will then summarize today's information in Spanish, and afterwards we'll both be available for questions. So let's start with the first slide. As always, we're going to go ahead and look at some of the trend data. We'll start by looking at cases. As you could see, that's the graph that's over on my right. This week, there's been a daily average of about 571 cases. That's that green trend line. 4 weeks ago, as you can see, we were at about 264 new cases. So cases really doubled over this past month. And we still do report cases because they help us see these week-to-week trends. But I think it's important to note that they're an undercount since they don't include home tests and the number of actual infections we know is much higher. And while you can see on this trend line that case numbers are relatively low compared to many other points this past year, I also want to note that it's a bit unfair to make those comparisons because there's less reportable testing. And just to sort of explain what I mean by that, remember reportable testing are test results that come to us. They come from labs. They mainly reflect PCR testing, and it's gone down dramatically. You can see that on May 1st in 2022, there was an average of 134,000 reportable tests a day. 1 year later, in May of 2023, the figure had dropped to an average of just about 13,000 reportable tests per day. And with the end of the federal public health emergency in May, the average number of tests was cut in half in just 1 month, with an average of 6,500 reportable tests per day on June 1st. For this past week, there was an average of about 5,400 reportable tests each day. But we can look at hospitalizations to see a more stable indicator of the impact of COVID-19. That's because this definition hasn't really changed over time. And for the past few months, the percent of these hospitalizations that are associated with individuals seeking care for COVID-related illness has remained steady at about 50%. This week, the daily average number of COVID-19 hospitalizations is 521. That's the yellow trend line. On August 2nd, we had about 245 hospitalizations. So here as well, we've doubled the number of hospitalizations. However, as you can clearly see, hospitalizations remain well below the high numbers we saw during the 2022 summer and winter surges. In fact, there are only 4 other periods during the entire pandemic when hospitalizations are lower than what we're reporting this week, and one included earlier this summer. Public Health also tracks the proportion of emergency department encounters due to COVID-19, and those also have gone up slightly. Currently, about 5% of emergency department encounters are for COVID. 4 weeks ago, it was at about 3%. Deaths is the last graph on this slide, the lower graph. And you can see we haven't yet seen a corresponding increase in deaths. Currently, we're reporting an average of 1 death per day. I know many of you had been with me when that number was dramatically higher. This could be because deaths, as we all remember, are a lagging indicator, and the number could rise in the upcoming weeks, or it could reflect reduced risk of dying associated with higher rates of vaccination and the use of powerful therapeutics. We're also tracking what proportion of total deaths in LA County are due to COVID-19. This week, about 2.5% of total deaths from all causes were associated with COVID-19. At this time last year, COVID-19 was implicated in almost 5% of deaths. For each of the 2 weeks prior, it was about 1% of total deaths were attributable to COVID-19. It is possible that this could be an early indicator that maybe we're going to see some increased numbers of deaths, yet with only 1 week of data, it's too early to determine if this is a trend. And as a reminder, during the peak of the surge last summer, it was 7% of deaths were associated with COVID. While there's a lot of relief in this historically low number of reported COVID deaths, I know there are many people in LA that have lost a loved one to COVID-19, and I offer my sincere condolences to everyone. Next slide. We're still able to measure virus levels in the community by looking at wastewater concentrations of SARS-CoV-2, which is the virus that causes COVID-19. This data is collected from the Joint Water Pollution Control Plant, Hyperion, Lancaster, and Tapia, and it covers about 77% of LA County's residents. And while wastewater concentration gives a more complete picture of community infection levels, because there's a 2-week delay in this reporting due to the time it takes to process the samples, this information reflects conditions a couple of weeks ago. For the most recent data collected for the week that ended August 19th, wastewater concentrations were at about 26% of where they were during the 2022-23 winter peak. Concentrations began to slowly increase in early July from a low point of about 8% of the winter peak. Even with this increase, we've not yet triggered our early alert measure of medium or high concern, reflecting similar trends that we're seeing in the other COVID data points we just talked about. Next slide. But these higher rates of transmission, while they're not a cause for alarm, they do translate to more outbreaks in LA County across schools, work site, and healthcare facilities. Unfortunately, this often means missed days of work, missed learning, and increased risk for those who are most susceptible to severe illness. Sorry. On this slide, you can see trend lines tracking the number of new outbreaks opened each week, and each color represents a different sector. You can see across the board, we've had recent increases in all of the sectors. The pink line is the represents skilled nursing facilities, and we've had 35 newly opened outbreaks for the week of August 20th through the 26th. This is one sector we are monitoring carefully, since there have only been a few times in the past year and a half when we saw this many new outbreaks in skilled nursing facilities, and these were during the previous summer and winter surges. Because the residents in the skilled nursing facilities are vulnerable for severe illness from COVID, there are prescribed infection control practices that are automatically implemented during outbreaks. These include requiring staff and visitors at these sites where there are outbreaks to wear masks. If you're visiting someone in a skilled nursing facility and that skilled nursing facility is in the middle of an outbreak, we'd also strongly recommend that you test before the visit. All of the nursing homes have received tests from public health that visitors can use prior to entering the facility. It's important to note that although the number of outbreaks is high, these outbreaks so far at our skilled nursing facilities are associated with fewer resident deaths than what we documented last year. And this likely reflects high rates of vaccination. 75% of residents in skilled nursing facilities received the bivalent booster, and good access to therapeutics. I do want to talk for a minute about schools, where, as you can see, there were 27 newly opened outbreaks for the week that ended August 26th. That's the blue line on the graph. This is similar to the number of outbreaks that were reported when schools opened after summer break in August 2022, and the number of outbreaks seen at schools after major holidays. We know that schools are especially susceptible to outbreaks due to the large number of people who are indoors together for an extended period of time. While this increase is not unexpected, since students and staff just returned from summer break, it is noteworthy because it means that COVID is still capable of causing disruptions at schools. We do urge parents to keep their children home when they're sick and to report positive COVID tests to the school as soon as possible. Businesses and organizations, as just a reminder, do have to report clusters of cases to public health. This allows us to determine if there's an outbreak and then provide support to limit transmission. As a reminder, Cal OSHA has also issued regulations for outbreak management at work sites that specify masking, testing, and isolation requirements. Next slide. In the past, new variants, subvariants, and strains have often fueled increases in transmission. This is why in LA County, we continue to regularly sequence local COVID-19 specimens to know what strains are circulating and to prepare if changes will affect the impact of COVID-19. During the most recent local sequencing for the 2-week period that ended August 5th, EG.5 was the most dominant strain in LA County. It accounted for just about 21% of our sequence specimens. This is the first time a strain has accounted for more than 20% of sequence specimens since early July. As a reminder, EG.5 is a descendant of the Omicron XBB strain. It just had too many numbers after it, so now we call it EG.5, which is what this new fall vaccine is targeting. The next most dominant strain is also XBB. It's XBB.1.5, and it accounted for almost 14% of sequence specimens. Since it takes time to sequence positive specimens, the CDC uses modeling to predict the proportion of strains circulating right now. For the region that includes California, it's estimated that EG.5 remains dominant, and it probably accounts for about 25% of the current cases. As you can see, this is rising slowly. We're not having huge jumps here. It is just a slow, steady rise at this point. The WHO and CDC are also following a new subvariant of possible concern, which is called BA.2.86. This new strain has 35 new mutations on the spike protein when compared to XBB.1.5. The number of genetic differences is roughly of the same magnitude as what we saw between the initial Omicron variant, remember we call that BA.1, and previous variants such as Delta. It is thought that because of the large number of mutations, BA.2.86 may be more capable of causing infection in people who previously had COVID or who received the COVID-19 vaccines. 25 cases have been identified globally across 8 countries. 4 incidences were identified in the United States, 3 through testing and 1 through in New York through Wastewater. There have not been any cases identified in California or in LA County of BA.2.86 as of yet. And at this point, there is no evidence that this strain is causing more severe illness. What is known is that this is still COVID, and it spreads in the same way, meaning that we can continue to follow actions to protect ourselves and others from infection. Stay home if you're sick, get tested for COVID-19 if needed, seek treatment if you have COVID-19 and you're at high risk of getting sick. If you choose to wear a mask, wear a high-quality mask that fits well over your nose and mouth. Improve ventilation, wash your hands, and stay up to date on your vaccines. Next slide. Hospital admission data is the metric that's used nationally by CDC to denote levels of risk. While LA County remains in the U.S. Centers for Disease Control and Prevention's low hospital admission level, with 6.3, a rate of 6.3 weekly COVID-19 hospital admissions per 100,000 people, these rates have increased slowly over this past month. Similar trend to what we saw with our hospitalization numbers. If our COVID-19 hospital admission rate continues to increase at the same rate it has these past 3 weeks, LA County could move to the medium hospital admission level in about 4 weeks. CDC does link hospital admission levels to suggested protective actions that can be taken to reduce risk. Next slide. While COVID-19 is still very much with us, we're no longer in the emergency phase of the pandemic. And based on this, LA County is updating our response activities. Our efforts continue to prioritize reducing severe illness and death especially among more vulnerable populations, and also ensuring that healthcare systems remain responsive to the wide array of patient needs. But with effective vaccinations, tests, therapeutics, and relatively low rates of hospitalization and deaths, our work currently is centered on responding to outbreaks to help reduce transmission and the associated disruptions that come with outbreaks, and on ensuring that there's good access to tests, vaccines, and therapeutics to help us reduce the disproportionate way that COVID-19 affects communities based on income, race, and age. Next slide. With the upcoming Labor Day weekend, lots of people have been asking us for tips on how to safely enjoy the holiday, and if the increased rates of transmission mean they need to change their plans or take different precautions. We want everyone to enjoy this last weekend of the summer, and we think this can be easily done with some simple basic safety measures. For people who are not at increased risk of severe COVID outcomes, consider the following. Masking is appropriately now based on individual preference, except for a few situations where masking may be required. This includes where it's required at a site or required as part of outbreak management. And as I noted earlier, Cal OSHA has some rules requiring masking at work sites as well. But masking does remain strongly recommended in a few places and in a few situations. You should consider, especially with a lot of transmission, wearing a mask for 10 days after you had an exposure to someone who was positive for COVID-19 when you're in these public indoor spaces. On days 6 to 10 after you've been infected, if you're leaving isolation, it's a good idea to keep your mask on for those 4 days. And given higher rates of transmission, this would be a good time to put your mask on, well-fitting, high-filtration mask when you're on public transit and when you're in healthcare settings. COVID testing also remains a valuable tool. People should be testing after they had a known exposure. They should test if they have COVID symptoms, fever, cough, headache, extreme fatigue. Knowing your status means not only can you access medicine that will reduce your illness severity, but you can take some steps to prevent transmitting to others. For people with increased risk of severe illness or death from COVID-19, and those who live or work with someone who's at high risk, or for those who just want to take some extra precautions to avoid illness, masking when you're in indoor spaces with lots of people and or there's poor ventilation will offer you additional protection, even if everyone else in that space is not wearing a mask. And it may be a good idea if you're at higher risk for severe illness to ask folks visiting with you to test for COVID before you get together. I do want to talk for a minute about vaccines, just because there's a lot of evidence that COVID vaccines have significantly reduced the rate of severe illness and death from COVID-19, even for people who had the virus before. In mid to late September, there'll be a new COVID-19 vaccine, which will provide increased protection against the COVID strains that are circulating right now. And most everyone will benefit from this added protection. The new vaccine is formulated to provide protection against XBB strains. That's really more than 90% of what's circulating. Pfizer and Moderna will issue an mRNA vaccine, and Novavax will issue a vaccine that's a more traditional protein subunit vaccine, same technology we use for flu, HPV vaccine, and some other vaccines. The CDC is already testing the effectiveness of this vaccine against the new BA.2.86 strain. We do know that vaccines don't have to be a perfect match to give a boost to your immunity or to be effective against reducing severe illness. If you have questions or concerns about getting another COVID vaccine or even your first COVID vaccine, this is the time to talk to your healthcare provider or to call us at 833-540-0473 so we could try to answer your questions and get you whatever information would be helpful. We encourage people to make their plan now with their family for getting vaccinated this fall. I do want to note free vaccines will continue to be available at many locations in our county, at sites, particularly sites that we're running. And at these sites, there'll also be no requirement to disclose immigration status. You can safely receive the COVID-19 vaccine and the flu vaccine at the same time, and we're likely again to have flu circulating this fall and winter like we did last winter. And everyone should stay up to date on seasonal recommended vaccines. This is especially true for older people, people who have underlying health conditions, and people who have increased exposure because of their work or if they're a child that's attending school. Once this vaccine is approved and authorized by the FDA and recommended by CDC, it will be in the commercial market. And that means for many residents, your vaccines are going to be covered through your health plans with no cost sharing. And it'll be available at healthcare provider offices and at pharmacies. Uninsured and underinsured children will get the vaccine through a program we operate in LA County called Vaccine for Children, which has hundreds of providers. And as I noted, for uninsured and underinsured adults, they'll get free vaccine through the new Federal Bridge Access Program. We'll have participating health clinics, Department of Public Health sites, and some retail and independent pharmacies. We will put a list up on our website as soon as we have it. Public health will continue to prioritize making sure vaccines are easily accessible for uninsured, and seniors, especially in underserved and under-resourced communities. In closing, I do want to say that we're likely to have another briefing later in mid-September by our vaccine team in order for us to share further details about the updated fall vaccine, who's eligible, and where exactly people can go to get it. While we're not doing regular briefings any longer, we're always available to answer questions, and we'll continue to provide updates in our weekly releases. COVID-19 is still changing, and we can't accurately predict what will happen this fall. What we do know is how to be prepared to take appropriate safety precautions as needed to protect ourselves and our community. This helps us minimize disruptions at schools and workplaces associated with more spread of the virus. Before we move to questions, I'm now going to hand things over to Dr. Gemma Morales Meyer for remarks in Spanish.
Buenas tardes y gracias por venir. En el condado de Los Ángeles hemos estado viendo un aumento gradual y constante en la transmisión de COVID-19 durante las últimas 6 semanas. En comparación con hace 4 semanas, el promedio de casos diarios se ha más que duplicado y las hospitalizaciones de COVID positivos son el doble. El condado de Los Ángeles informa un promedio de una muerte cada día debido a COVID-19 y este número se ha mantenido estable durante el último mes, lo cual es muy positivo. Sin embargo, es importante notar que, aunque tenemos estos aumentos, al condado de Los Ángeles le está yendo relativamente bien en comparación con otros puntos durante la pandemia. Las hospitalizaciones todavía están cerca de mínimos históricos y las muertes están en su punto más bajo desde el comienzo de la pandemia. Con esa perspectiva, estos aumentos no señalan una situación de señalan una situación de emergencia. En cambio, queremos asegurarlos y notificar a los residentes que estén conscientes y tomen precauciones sensatas para mantenerse saludables a ellos y a sus seres queridos. Las personas que son más vulnerables a enfermedades graves o muerte a causa de COVID-19 incluyen las personas mayores, inmunocomprometidas, con problemas de salud subyacentes o que nunca han sido vacunados, deberían de tomar medidas para evitar riesgos adicionales. El uso de cubrebocas se basa en la preferencia individual, excepto en los lugares donde lo quiere el sitio. En cualquier momento, los lugares de negocios, instalaciones de atención médica o eventos pueden requerir el uso de cubrebocas. Si una persona tiene un mayor riesgo de contraer COVID-19, es posible que también desee usar mascarilla en lugares públicos con mucha gente y o mal ventilados. También se recomienda el uso de mascarillas a todas las personas mientras viajan en transporte público, en centros de transporte como aeropuertos o estaciones de autobuses y mientras visitan centros de atención médica y locales para las personas de la tercera edad. Las personas que tienen síntomas de enfermedad respiratoria deben usar una mascarilla cuando estén cerca de otras personas, al igual que las personas que han estado expuestas al COVID-19 o que están infectadas con el COVID-19 y salen de cuarentena entre los días 6 y 10. Debido a que el COVID-19 aún puede causar una enfermedad grave, las pruebas de COVID en el hogar también son una herramienta conveniente y deben usarse si ha estado expuesto al COVID-19. Si tiene posibles síntomas de COVID-19 como dolor de garganta, fiebre, tos o fatiga extrema, o si visitará o asistirá a un evento con personas que son más vulnerables. COVID-19 todavía está cambiando y no podemos predecir qué sucederá este otoño. Lo que sí sabemos es cómo estar preparados para tomar las precauciones de seguridad adecuadas según sea necesario para protegernos a nosotros mismos y a nuestra comunidad. Esto ayudará a minimizar las interrupciones en las escuelas y lugares de trabajo asociadas con una mayor propagación del virus. A lo largo de la pandemia se ha demostrado que las vacunas ayudan a reducir la posibilidad de enfermedades gravemente y muertes del COVID-19, incluso si ya ha tenido el virus antes. Entre mediados y finales de septiembre habrá una nueva vacuna contra el COVID-19 que brindará una mayor protección contra las variantes de COVID que están circulando actualmente. Casi todo el mundo se beneficiará de la protección adicional. Si tiene preguntas o inquietudes sobre cómo recibir otra vacuna contra el COVID o su primera vacuna contra el COVID, hable con su proveedor de atención médica o llámenos al 833-540-0473 para que podamos responder sus preguntas. Alentamos a las personas a hacer un plan ahora con su familia para vacunarse este otoño. Las vacunas gratuitas seguirán estando disponibles en muchos lugares del condado, en sitios donde tampoco existe el requisito de revelar su estatus migratorio. Puede recibir de manera segura la vacuna contra el COVID-19 y la vacuna contra la gripe al mismo tiempo. Y todos deben mantenerse al día con las vacunas recomendadas, especialmente las personas mayores, las personas que tienen problemas de salud subyacentes y las personas que pueden haber aumentado exposición debido a su trabajo o por ser un niño que asiste a la escuela. Puede visitar vacunatelosangeles.com para encontrar ubicación cerca de usted y buscar información en las próximas semanas sobre cuándo estará disponible la nueva vacuna. Si espera que la actualización de la vacuna COVID del 23-24 dirigida a XBB sea aprobada para personas mayores de 12 años y reciba la autorización de uso de emergencia para niños a mediados o finales de septiembre. Se espera que los CDC recomienden la vacuna actualizada inmediatamente después. Una vez que la vacuna sea aprobada y autorizada por el FDA y recomiendan por los CDC, estará en el mercado comercial. Para la mayoría de los residentes, las vacunas deberían estar cubiertas a través de sus planes de salud, sin costo al paciente, y estarán disponibles en los consultorios y farmacias de sus proveedores de atención médica. Los niños sin seguro o con seguro insuficiente podrán recibir la vacuna de forma gratuita a través de los proveedores de vacunas para niños, que incluyen nuestros sitios del Condado de Los Ángeles. Los adultos sin seguro o con seguro insuficiente podrán recibir la vacuna de forma gratuita a través del nuevo programa de acceso que se llama Bridge Access Program, a través de participantes del FQHC, sitios en el Condado de Los Ángeles y del Departamento de Salud y farmacias. La salud pública dará prioridad en sus esfuerzos de proveer las vacunas para las personas sin seguro, con seguro insuficiente y las personas de tercera edad en comunidades sin o con bajos recursos. Muchas gracias.
Muchas gracias, Emma. We'll open for questions at this point. So,
Any questions in the room? Okay, we have several questions sent in. Two from Ron Lynn at the LA Times.
okay.
Has your department issued any an increasing number of temporary mask mandates in places like work sites to help end an outbreak. How long do they typically last?
Okay,
And
let me just do one question at a time. No, it's standard practice. It's always been standard practice for us. When there's an outbreak, our team goes in, it makes an assessment. If it seems like, there's a lot of spread or the potential for a lot of spread, masks are generally required. And I would say, because we've had many more outbreaks at other periods of time, a higher number of outbreaks, those have been times where, many more places have been told that their employees have to mask. I will say it's a reasonable request. It usually lasts until we close the outbreak. In general, 14, 21 days out, we stop seeing new cases associated with the index case, and we're able to close the outbreak and then lift that requirement that people wear a mask. And it's also, if you're in a business that has like multiple stories, we don't tell everybody on every floor to mask. It's generally a reasonable expectation that people on the floor where there's been a fair number of cases are those that are being asked to mask while they're at work.
his second question, is there a concern about Labor Day becoming a super spreader weekend?
Well, we've seen, we continue to look at the trend lines, and I just showed them that when we get together around holidays, we can see some increases. I want to note that after the July 4th holiday, it was a very small increase. Our hope is that while there may be some increases associated with Labor Day, particularly because we also have a lot of children going back to work and school, that we'll see a bump up, but we're hoping again that it'll be a small bump.
Another question from Marissa Evans. How has the increase in concerts and events around the county shaped how the department is messaging around COVID-19?
I think our messaging is similar to the way many others are messaging, which is there's always a risk if you're in crowded situations, particularly if they're indoors with lots of other people, especially in those situations where people have been traveling from many different places to come together for a concert or an event. Many of our event venues in LA County are in fact outdoors, and that obviously is very helpful because there's less chances of spread in an outdoor event. But for those people who are vulnerable for severe illness, they can and go ahead and make that decision that it makes sense for them to put on a well-fitting high filtration mask that will add plenty of protection. They also, and we remind people about this all the time, wash your hands frequently, especially before you're going to be eating or drinking.
Several questions from Howard Bloom. The first one is, we are hearing anecdotal reports of lots of kids and faculty out with COVID. Is there a reliable sense of what is going on out there?
Well, yes. I mean, we obviously track that. Schools do report to us if they have 3 or more cases in a 7-day period. As you know, that translated into, there were hundreds of cases over the last week, but it only translated into transmission at a school site in, sort of the 30 or so, the 27 outbreaks that I noted. So while there are a lot of people who are testing positive, and I appreciate that people are testing and then notifying schools and then staying home, which is exactly what we ask people to do, much of that exposure has happened in their families or in the community and not happened at schools. However, with lots of people having exposures and many more people testing positive or being symptomatic for COVID, we all need to be mindful of not coming into work or school if we're sick, testing if we've had exposures, wearing masks appropriately if we've had that exposure, so that we can try to limit that transmission.
Follow-up from Howard. At this point, when should people wear masks in schools, and is it ever mandatory?
Well, ever is not a word I'm comfortable with. Everyone knows that, I think by now, that there's no place for that level of certainty with this pandemic at this point. So I'm not going to say there's never going to be a time where we might need to all put our masks back on. I am going to say we certainly don't need to all put our masks back on now. I think, again, we're in a space where people assess their own risk or the risk of their family members and make decisions accordingly, is a good place for us to be. And that means at schools, you will find some children and some staff and some teachers who will be wearing their masks. And we ask people to respect everyone who wears a mask. It's really not up to them to defend why they're wearing their mask or explain why they're wearing their mask. We should all be respectful. There are some places where, in fact, if somebody's wearing a mask and you're in a space, a closed space with them, you might ask them if they want you to put a mask on, just common courtesy. But I think at this point in schools, it's individual preference where those who are at higher risk may want to reduce that risk by going ahead and wearing a well-fitting, high-filtration mask.
The final question from Howard is, Dr. Ferrer said sick children should stay home from school. To what extent, if any, is her advice somewhat different than what LAUSD is saying to families, which is, in essence, that children with mild symptoms of illness should go to school?
I don't think we're really differing. I think we're both saying the same thing. If you're sick, you should stay home. If you're a child or you're an adult and you're sick, you should be staying home. If you have respiratory symptoms in particular, please stay home, get tested. Make sure that you're not inadvertently spreading COVID-19. I want to note we're moving into the respiratory illness season. We'll have RSV, we'll have flu. It's super important that children who are not feeling well, who are having an active cough along with not feeling well, get tested and remain home away from others so that they don't spread.
Any final questions in the room?
Thank you. Thanks, everyone. And again, our vaccine team will do another briefing in about the middle of September. We anticipate to just talk about the distribution of the new vaccine for LA County.